The mass firings of workers at federal health agencies is underway. Termination notices went out this morning.
Thousands of jobs are being cut within the Department of Health and Human Services, at the Food and Drug Administration, the National Institutes of Health, and the Centers for Disease Control and Prevention.
We spoke today with Tom Frieden, who headed the CDC from 2009 to 2017. Dr. Frieden, 20,000 in cuts from Health and Human Services is undoubtedly more than you would think is wise, but zero cuts is probably not the right standard either. So where should the efficiency at the HHS land?
The administration seems to be starting with a goal of reducing large numbers of staff, but when you look at what those staff are doing, they're protecting Americans. This is a recipe for disaster. It's not going to make us healthier. It'll make us sicker. It'll increase healthcare costs for families, for communities, and for the country.
With these cuts, without these people, what could people see in practice in their everyday lives?
An outbreak comes to your community, there is no availability of people to surge in and help stop it. A disease starts anywhere in the world, and you want to hear about it and find out from the actual scientists and experts who know about that disease what the risk is to you and your family. You don't have those people to rely on anymore.
And what about down the road, Dr. Frieden? Sometimes there are things that are not as immediate, or things that once they happen, it's too late to suddenly stand up a force to combat it.
One of the most important things the CDC does is to track health trends. Whatever you think we should be doing about them, we absolutely need to know what's happening. I'm afraid what we're seeing here is an approach that's saying, let's hit a number. That number is the number of staff we get rid of. How about hitting a number, the number of people who don't get diseases that we can prevent?